Hello, everybody, and welcome to the Ask Greg series. Glad you could join us for our third episode. I'm Greg Leveris with Horizon Business Development and an Archibus aficionado. I'm here to discuss product capability and share experiences with the broad functionality of the software. And of course, it's reminding me that we have this presentation. So let's go ahead and get started. Today's topics will be about managing training for employees, what their PPE, personal protective equipment is, and maybe reporting some incidents. And so, for instance, with our webinar guidelines today, of course, we are starting with everybody on mute to conduct the presentation. At the completion of the presentation, we will open the meeting for questions. You can submit your questions during the presentation via the question box. So as you look at your little menu for the system, just go ahead and open that up and submit your question. Or you can also raise your hand and we can unmute you to speak directly to your question. And again, we'll do that at the end of the presentation. Just wanted to kind of catch you up. What are we doing with this Ask Greg series that might help you? And while I'm doing that, I'm going to go ahead and disable my camera now so that we can turn that off. So one of the reasons that we decided we wanted to do this was to showcase the capabilities of Archibus. By now, many of you have used some of the product, but even those pieces that you're using, you're not fully familiar with. So we wanted to make sure you're aware of all of that comes with Archibus. That's an important aspect, and also things that you may not be touching. We certainly want to share the knowledge that we have with the product and our experiences, and also some of the experiences of our users. We want to start looking at ways to help engage with our other Archibus users so that there's a direct line of communication between you and other users at other organizations. And we are developing a library of material that will be made accessible to you. We already have some of that up, and I'll talk to you about the end of the session. And in general, we want to create a community forum for those people that are using Archibus so that they have a place to catch up with each other. So far, we've run 2 episodes, and the first episode was about doing hoteling and booking workspaces. And so the idea was we wanted to explain some of the different type of environments and what things that you could do, switching from traditional layouts where everybody gets a seat to agile layouts where people come in and pick a place to work at any given time. And we spent a little bit of time looking at ways to even do that within our current work environments. The other thing that we talked about in episode 2 then was to cover the concept of team space, where we actually took the concepts of organizational space and helped consolidate it so that one group could share space with more people than were actually number of spaces available. So we walked through some scenarios. In both of the scenarios, we talked about this in relation to back to work, because I thought that was an important aspect as we're all planning these kinds of activities. So today we're getting into a broader topic, which is environmental health and safety. And, as we've been talking to our clients, people have wanted to know what is their biggest concern with having employees maintain their own personal protective equipment. And the reason that we raised this is because Archibus made an offer at the beginning of the summertime as a result of the COVID-19 experience, where anybody who has Archibus for version 23 or later would be able to take advantage of using the environmental health and safety application and get it for free by contacting your business partner, us, and having us update your license and being able to use that through the end of next September at no charge. If you decided to keep the application, we would then get you a full license for that application with the cost of subscription being added to your annual fees. So what I'm going to do now is give you kind of a high-level overview of some of the things that you need to do. We'll talk about setting up training programs and what the requirements for them are. As you can see, there are a variety of topics that we can cover, but I think something that's near and dear to our heart would be things like using face masks, gloves, face shields, and of course, disinfectant wipes and cleaning products as an example. So for the example today, we're going to extend a little bit of what we talked about from the previous two sessions and get into the concept of back to work. And we want to set up categories of training for different types of workers based on the different phases that we're going to implement at our organization. So phase one, we certainly want to have cleaners, COVID-19 champion, office workers, and other types. Phase two would include people like lab techs and project engineers and many more, of course. And phase three would be, maybe quality controller, CAD GIS operators, and others. And at each level of work category, we want to set up specific training programs on how to bring those people on board. So for instance, one of the things that we want to do is set up what we call COVID-19 awareness, which you can see on the screen is the second line. And we set up program up to do that. And the next thing we do is, our category, I should say, and then we set up training programs under COVID-19. And we have three distinct programs we want to run. One is for cleaning. What are the guidelines for cleaning around the work environment, whether it be your desk, whether it be open common areas, whether it be elevators, light switches, etc. Two would be returning. What's expected to know in terms of returning to work? What are the guidelines for using elevators, for being in public areas, for conducting meetings? And then finally, what are the guidelines for running social distancing? What's the degree of separation between employees, and how can we best maintain those things? So in this training program, we focused specifically on one example, which is the social distancing. And the idea is that we want to set up that program and get employees to participate in that program, and also make sure that we provide the employees with the appropriate materials to work with, which in this case may be a COVID-19 kit, which we'll get into. Now, how do we go about assigning employees to training programs? Well, first and foremost, it's important that you are actually using Archibus to help track the location and manage all of the employees in the database, even if you have to connect to your HR system. So I'm going to run a little video here just to kind of give you a flavor of what's going on. And again, using Archibus, and for those who might ask, we're actually using V25.2 for this exercise, but this pretty much works the same across 23, 24, and 25. What I want to do is get all the employees in the administrative services group, and I want to get them on board with a social distancing training requirement. So we already see we have like 3 employees that are scheduled to be trained. What I'm going to do is add 5 more to them. I'm going to assign training to those employees. And what I want that training to occur is actually the 28th. And going back to the previous example of when we started this, demonstration in episode 2, back to work was going to be October 5th. So a week before people come back to work, we want to make sure they sign up and get trained on what's expected of them around social distancing. And that's the reason why we picked the 28th to do that. Now, maybe some people that are different, like a COVID champion or whatnot, might be trained sooner so they can help prepare staff. So if we look at and assign all the training, we can go back and take a look at specifically COVID-19 for any and all of the employees in our organization, and see what's scheduled or what schedules have been missed. So maybe in red, we're late on issuing and completing one of the items. In yellow, we can see some of the items that are pending near term, and everybody else is scheduled for the end of September as we describe. So we can use this to make sure that we track all of the people that are doing the training. Next thing we want to do is, for those employees that are coming into the office, we want to manage their personal protective equipment. And in terms of managing personal protective equipment, We certainly want to describe whether it's specific individual things like masks or gloves or disinfectant wipes, or in our case, what we did is we literally took a COVID-19 kit where we combine the gloves, the masks, and the wipes into one little kit. And what we want to do is supply those to all the employees that we set up for the system. And one of the things that we want to do is provide them with a weekly supply. And for the exercise today, given that we expect to be doing our social distancing through the beginning of July in 2021, we will end this program in 2021, assuming that things will allow us to get back to a more normal set of operation. We can always change that, but for now, what we're saying is every Monday, we're gonna issue to the employees a place where they can either pick up or distribute materials that they'll need for their weekly time in the office based on the frequency with which they come in. So now that we've done that, we then again go to any employee. So I took one of the employees that we have from that administrative services group, and what I did, because I have already assigned them PPE, that means every Monday they are expected to get their supply of face masks, of gloves, and disinfectant wipes, whether they pick them up in a central location or whether you make a decision to deliver them on the floor right to their room. It all depends on how you want to set up your specific type of program. And finally, we use all of this information to help define and track the cases. Now, obviously, when Archibus originally created this particular application, it was meant to record any sort of safety incident or accident at the location where you're conducting business. But again, we want to tie it specifically to doing some of the COVID-19 stuff. And so what we're going to do is focus on the process for creating incidents. As with everything else in Archibus, there are certain key data elements that we need to do. One, of course, is what are the different types of incidents we want to do. And imagine that we actually have something called COVID symptoms that allow us to check for those symptoms that are most commonly recognized, like cough and headache and nausea and muscle aches and congestion and other types of issues. Not everybody has the same set of symptoms, so you have to check with the employees to make a determination of what's going on. And then the second piece of that is, as we start identifying the employees, what do we want them to do? Well, we want them to quarantine themselves or stay away from the office where appropriate, or maybe they need to isolate themselves in a part of the office, depending on what you want to do. So here we're going to go through the process of reporting an incident. I'm not going to cover every little detail, but I just want you to get a sense of the kind of information that you will need to capture. So what we're going to do is jump in and track incidents. And so first thing we'll do is take a look at all of the current COVID-19 symptoms, and we'll basically review the entire list of cases that we have identified so far within the organization. We can create a new incident at any point in time. We've identified it as somebody who has it. Their injury is considered an illness. What were they doing? They were working at their desk when we received a complaint or an issue. We can record the date and time, so it's going to be 3 p.m. in the afternoon on the 26th that this happened. It giving the person multiple head issues that they have. We identified the employee from our database, and in this case, we happen to be in the NCO5 or TGD Technology Center, and we were working with Brian Baird. And there's an important reason why we want to know that, because we're tracking their location in this particular case, otherwise we'd have to stipulate. Now that we've created that incident record, we go to the site information. And in this case, because they were working at their desk, we immediately just grab their work location and add that to the record. So we now have their location. We can identify medical information such as Do they need immediate treatment, like maybe taken to the emergency room? Will they be hospitalized? In this particular case, the answer is no, we're just going to send them home. But that's not to say that might not be the case for everybody. We can also, of course, do some analysis as to maybe why that person was sick. So in this case, we may have determined that this person was not following all of our guidelines because they, oops, sorry, I pushed the wrong button. Let me get back on track here. I'll go a little bit further. Somehow I managed to skip up and got us out of sync here a little bit, so bear with me a second. All right, so as I was saying, what we want to do is get to what the response is, and as I had articulated, we had a failure to wear a mask. They were trying not to use a mask. They might feel that strongly. So now we have to go through the process of putting them in quarantine, getting them out of the office, and having them isolate or self-isolate from home, as an example. There's other details we can capture about this person, maybe add reports or records to go along with it, but this is sufficient for us to capture the details that we're looking for. So now that we have the incident properly saved, what I'm going to do now is go and take a look at what kind of reports we might be able to gather. And again, we'll use our video here to do so. One of the reports we have, of course, is telling us a little bit about where things are occurring in our facilities. So if we have a multi-building campus or multiple locations, we want to get a sense of what's happening either across our whole portfolio or maybe within one of the countries of our portfolio or provinces or a specific state or even site if we need to. In this case, we have 2 buildings that are showing cases. One has more than 6, and it turns out that it has 7. And the nice thing is, if we want to even take a look at the different places where floor plans, and this is one of the reasons why it's important to capture some of those details, because of all the incidents that we reported, only 2 of them in this building had an actual building, floor, and room. The others might have had building and floor or just building. So it's always important to get as much detail as you can. So 2 of the incidents showed us where we found this person, which will then help us communicate and inform some of the other employees in that area and talk about reinforcing some of the training and practices that we have. So now that we've kind of seen what we can do, we have this information to give us a sense of what's going on. Of course, that's just one of the many reports that we can generate. Let's take a look at one of the other ones we want to do. And what I want to do is a breakdown of incidents by type. So in this case, I want to, again, focus on those that are just COVID symptoms. I could do it for a specific building, for a particular department. These are all my current records. And, as you build up your, data catalog, certainly we don't want you to build up to hundreds and thousands, but if you like, you can certainly not only analyze the data within Archibus, but you can certainly analyze the data using Excel. So we can literally make it very easy to export the data to Excel and then follow whatever other analytical, processes that you want to incur with the information that you're being provided. So Archibus, is a pretty powerful tool that gives you a lot of capabilities to work. And then finally, for one last report, we're just going to do a simple incident count report. Again, we'll focus on incident type, and as you can see, we have a total of 11 cases of COVID symptoms that we have a record for. And now that we have this information, again, using that same kind of drill down, I could have easily gotten to the data from the chart. So I could have, grouped it by different buildings. I could have grouped it by department and focused just on COVID, just to give me a breakdown and analysis of the type of information that we have available. So that is reflective of what you can do with the ability to train your staff, getting ready to come back to work, tracking some of the personal protective equipment, and, getting into the practice of capturing data about items that you find so that you can then analyze and improve, the employee safety of your organization. So we've done that training. We've been able to track and associate PPE, whether it's for one-time or frequent use. And we've set up this incident reporting mechanism to help us analyze that data by the location and trends that we have. So what's coming up next? Our next episode will be on on-demand maintenance and intuitive work tickets. So we'll walk you through some of ways of allowing employees to submit tickets and integrating them to the maintenance management system. That is scheduled for Thursday, September 17th at 12 p.m. Eastern Daylight Time, and we'll send out the appropriate invitations. Remember, at any point in time, please submit your questions to askgreg@horizonsolutions.com. And one more thing, now that we've developed our catalog, we do have a YouTube page for Horizon Solutions, and you simply go on and search for Horizon Solutions in YouTube, click on it, and then you'll see a menu of videos, playlists, channels. We've actually created a playlist or channel that is specific to Ask Greg, and it's easy to access the videos. And you can see we already have episodes 1 and episodes 2, and pretty soon, within the next couple of days, episode 3 will be posted in here, and all future episodes will be posted here for you to see the information. So we certainly hope you find this information useful. And with that, we're going to open it up to questions. I don't know if we got any questions, Abby, Shoshana. Anything you can share with me?
We've got a few questions here right now. So the first one is there a way to mass assign people to training?
Yes. So in the screenshot that I showed, I, for instance, could filter the list of employees to a department and assign all the employees at the same time to training. So yes, that's a very powerful, way of quickly assigning people to training.
I have here is when you went through assigning people to training, it says why they're doing the training, whether it's the basic training people need to get to return to the office, or if they're doing it because they had an incident. Is that training the exact same every time you do it, or are there different programs depending on the reason why you have to do it?
You would set up training for each time. So, for those return to work, you'd probably set up one training program that everybody had. And then, as I gave an example, let's say an employee, got sick and didn't wear a mask, you might have a follow-up incident related training where you want to reinforce some of the training concepts that you had already. So it really depends on how you want to structure your program. That's not to say that you couldn't use the same materials in both cases, but you might want to have training just to record that you had to do refresher training as an example.
Okay, and the third question that we have here is, do you have any recommendations for an open concept floor with people unable to distance properly or to distance appropriately? What is or should be included in the PPE kits?
That's a great question. So I guess it really depends on the organization you're working for. There are ways of marking places where, first of all, where the employees should and should not sit. So Archibus has tools. Some of them are brand new for social distancing circles, which we can maybe post something as a special topic up on the Ask Greg series, where it allows you to designate what spaces are available for people to sit in. So that's step number one. And then the second part, of course, is a lot of it depends on if you want people to use the space, whether you use your cleaning staff to make sure that somebody professionally cleans a spot, or you give materials and let people be responsible for cleaning the spot that they worked in. The idea is to reduce the amount of touch. So if you're going to have different people sit in the same spot, obviously you want to minimize the amount of materials as far as furniture and personal items that are there. and make sure that they have sufficient wipes and whatnot to, clean the area before and after use.
The fourth question that we've got here is, for tracking incidents, who do you suggest be the person who is filling out the information you showed us that Archibus can track?
Again, that depends on how you organize, how your company organizes that. There could be a floor captain responsible for doing it. It could be an administrative person that could be doing that. It really depends on, what staff is there and who would be responsible for doing it. But it can be multiple people having the responsibility. You don't want it to be just any old employee. You want to, make sure that there is a level of consistency in preparing the material.
The next one that we've got here is, if an employee has been told to self-isolate / had a COVID-related incident, is there a way Archibus can prevent them from booking seats in the office?
So if I'm told that I have to quarantine, the EHS application will say that employee is quarantined. And then I guess, can you still, obviously you can tell the employee not to show up, but how do you make sure that they don't show up? One way, of course, would be to disable their badge for 14 days or whatever, until they get, enough sequential negative tests to prove that they don't have any, case of COVID going along. But one would be to disable their badge so that they cannot enter the building. Two, if you're doing any sort of room booking system, you could disable their access to the room booking system, but assuming they get in the building, chances are they could find a place to work. So that would definitely require a little bit of thought on your part, but I'm sure we can talk to you about the way you structure work and come up with some recommendations to do that.
So that looks like it's all the questions that we've been asked. Someone has said thank you.
Great.
Is there any other questions that anyone wants to ask?
Don't forget, you can raise your hands.
Okay, that looks like everything.
Okay, well, again, thank you very much. I will, Shoshana, I think for this one, I think we're going to want to post a little extra video on that social distancing circles thing. So let's make sure we do that before the next topic, okay?
Okay.
All right, thank you, everybody, and be safe out there. Thank you. Bye-bye.